Autism, often referred to as autism spectrum disorder or ASD, is not a disease or an illness. It's really a different way of thinking, interacting, and experiencing the world. Think of it as a neurodevelopmental difference. The brain develops and processes information in a unique way. This isn't something that needs to be cured, it's a fundamental part of who a person is. People on the autism spectrum have distinct strengths and challenges. Understanding this is the most important first step. The term spectrum is key. It means a wide range of experiences and characteristics. No two autistic people are exactly alike. Some may be nonverbal and need significant daily support. Others are university professors, artists, software engineers. This diversity makes the spectrum beautiful and complex. Move past old stereotypes. Understanding autism is about embracing neurodiversity. The path to an autism diagnosis often begins with a simple observation. A parent, a teacher, an adult might notice patterns that feel different from the norm. For young children, early signs can be subtle. A parent might observe a toddler isn't making much eye contact, or not responding to their name being called. They might not point to show interest, like a plane in the sky or a dog in the park. A child might prefer to line up their toys in perfect rows rather than engaging in pretend play. They might play alongside other children but not directly with them, seemingly in their own world. Repetitive behaviors are also common. Hand flapping, rocking back and forth, repeating words or phrases. They might be highly sensitive to sounds, lights, or textures. For adults seeking diagnosis later, signs are viewed through lived experience, lifelong social confusion, workplace stress, social hangover, or intense interests. A consistent pattern of behaviors combined with social communication differences might prompt a conversation with a pediatrician. Notice the collection of signs, not one isolated behavior. These are clues that suggest further exploration could be beneficial. Once you've decided to seek a formal evaluation, the next question is, who can actually provide an autism diagnosis? It's not something your family doctor or general pediatrician typically diagnoses on their own. The process requires specialized training. Professionals qualified to diagnose autism are usually part of a small dedicated group. Common professionals include clinical psychologists and neuropsychologists skilled in psychological testing and interpreting complex multi-source information. Developmental pediatricians specialize in child development and are experts at identifying conditions like autism. Child and adolescent psychiatrists can also diagnose autism and often focus on co-occurring mental health conditions. In many cases, a multidisciplinary team is considered the gold standard. Psychologists, speech-language pathologists, occupational therapists working together. Speech-language pathologists assess verbal and nonverbal communication. Occupational therapists evaluate sensory processing, motor skills, and daily living abilities. Finding these professionals can be challenging and wait lists long. The best place to start is often your child's primary care physician for a referral to a specialist. You can also contact local autism advocacy organizations, university medical centers, or children's hospitals with diagnostic clinics. Advocate persistently for the right team. Finding the right professional is a critical step to ensure careful, expert assessment. The formal diagnostic process almost always begins with a detailed conversation, the comprehensive interview or intake session. This is not a quick chat, it's an in-depth exploration from the earliest days of development to the present moment. Clinicians will ask about pregnancy, birth, early milestones, when the child smiled, babbled, walked, or said first words. These details build a foundational timeline that helps inform the evaluation. The clinician asks specific questions about social communication. How does your child get your attention? Do they bring toys to show you? They ask about friendships, imaginative play, and understanding others' perspectives. Another focus is restricted and repetitive behaviors, intense interests, attachment to routines, and reactions when routines change. Clinicians ask how the individual reacts to disruptions and observe repetitive movements. Sensory sensitivities, to noise, light, food textures, or clothing, are a major part of the interview. Be prepared, jot down notes, gather report cards, look at baby videos, and reflect on life history if you're an adult seeking diagnosis. There are no right or wrong answers. This deep dive ensures a thorough, accurate evaluation. After interviews, the next major step is direct observation, seeing the individual's behavior firsthand. Clinicians are trained to observe social communication, play skills, and interaction. For young children, this can look like play. The evaluator will use toys and activities designed to elicit social and communicative behaviors. They observe how the child uses eye contact, gestures, pointing, waving, and imaginative play. Assessing back-and-forth interaction and response to social initiation is key. The ADOS-2 is a semi-structured, standardized observation tool often called the gold standard, with age-appropriate activities. For adolescents or adults, observation may include conversation about emotions, relationships, or storytelling tasks. Clinicians record responses systematically during activities to identify patterns. There is no pass or fail. The goal is a comfortable environment where natural style can be observed. Observation combined with developmental history moves the clinician closer to an accurate understanding. Direct observation is a crucial piece of the diagnostic puzzle. Alongside interviews and observation, the diagnostic process relies heavily on standardized assessment tools. These scientifically designed questionnaires and rating scales make the evaluation objective and consistent. Examples include the Social Responsiveness Scale, SRS, and Gilliam Autism Rating Scale, GARS. Parents and teachers often complete these. The ADIR is a structured caregiver interview covering the full developmental history and core autism areas, social interaction, communication, and restricted behaviors. Standardized tools provide quantitative data that complement interviews and observations, making the process data-driven. Scores, developmental history, and direct observation combine into a robust diagnostic formulation. Think of it like a detective solving a case. Interview provides backstory, observation provides live evidence, standardized tools provide forensic analysis. All pieces are essential to reach an accurate conclusion and useful recommendations. Clinicians share findings in feedback sessions where families can ask questions and receive clear recommendations. The report will include suggested supports and next steps, not just a label. A careful, combined approach leads to a helpful, actionable diagnosis. Receiving an autism diagnosis can bring a wave of emotions: relief, worry, understanding. For parents, it can be relief at finally having an answer. For adults, profound self-understanding. A diagnosis is a roadmap to supports: therapy, educational adaptations, community resources, and peer connections. Clinicians schedule feedback and recommend therapies like speech, occupational therapy, or behavioral programs such as ABA when appropriate. Speech therapy supports communication. Occupational therapy helps manage sensory sensitivities and motor skills. Educational supports through an individualized education program can adapt the learning environment to the child's needs. For adults, community and peer support, online and in person, offer validation and belonging. Adults may pursue therapy for social anxiety, executive function supports, workplace accommodations, or disclosure conversations with HR. The diagnosis provides language and tools to build an authentic, supported, and fulfilling life. The path forward is unique to each person. This guide walked you through the process with clarity and compassion, a beginning toward access, understanding, and support. If you suspect autism for yourself or a loved one, talk to your primary care provider or local resources to begin the journey.